Hi, my name is Mackenzie Williams, and I will be talking about the effectiveness and safety of a single oral dose of secnitazole and trichomoniasis in women. Trichomoniasis, also known as trich, is a commonly sexually transmitted disease. Someone becomes infected by having unprotected sexual intercourse. Individuals that are infected usually don't know that they are infected due to symptoms being asymptomatic and different within each person. Women are more at large to develop trichoniasis versus men. Current studies determine that a multi-dose regimen of metronidazole um, is effective for trichomoniasis. The only thing is that it's multi-dose, so adherence isn't that good. So the purpose of this study was, of course, to evaluate the effectiveness and safety of a single oral dose of trichonidazole in women with trichomoniasis. So patients were given trichonidazole or placebo during this trial. The clinical question is female patients between the age 12 and up with trichomoniasis, does a single oral dose of trichonidazole have an outcome of a negative microbiological test of cure? Financial support was sponsored by Lupton Pharmaceuticals. They monitored the trial, they performed the statistical analysis while giving additional money as need be. The design of this study was a multi-center phase 3 randomized placebo-controlled delayed treatment double-blinded study between April 23, 2019 to March 18, 2020. Patients were enrolled in 9 different sites in the United States, so Alabama, Florida, Tennessee, Illinois, Mississippi, New Jersey, North Carolina, South Carolina, and Virginia to evaluate the effectiveness of a single oral dose of secnitazole in the treatment of trichomoniasis. The patients were randomly assigned to a treatment group or the placebo group, and that was based on the site of the patient and then the clinical symptoms that were recorded at the initial visit, so baseline. Eligible patients were females or adolescents of 12 years and older. Patients had to be initially diagnosed with trichonidazole by testing positive of one of the 2 diagnostic tests, which was a wet mount or a rapid test, or a nucleic acid amplification test, also called NAB. There were 2 populations studied during this trial, and it's going to be modified intended to treat. And so those were patients who tested positive for trichomoniasis at baseline, and then they were negative for gonorrhea and chlamydia via a NAT test at baseline. Per protocol was going to be also those people that modified intended to treat is included in this, but this also included HIV and people that had bacteria vaginosis, so BV. All patients had to provide a written consent before engaging into the study. Inclusion criteria includes adult females that were in relatively good health, adolescent girls 12 years old and older in generally good health, the diagnosis of a trichomoniasis for one of the 3 tests, so the wet mount, the rapid test, or the NAT test, no vaginal penetration or use of vaginal products, so sex toys during the treatment, and no vaginal intercourse until the final day of the treatment. Pregnant, lactating, or planning to become pregnant women were excluded from this study, as well as patients that had chlamydia, gonorrhea, or genital herpes outbreak. If they had an acute urinary tract infection, or if they had received antibacterial therapy or topical antifungal therapy 14 days before the initial visit. The primary outcome was a microbiological test of cure through days 6 to 12, so that's visit 2, after being dosed at visit 1 in the modified intended to treat population. So the primary outcomes measured were the comparison between the absence or presence of symptoms at baseline and the second visit, and a negative vaginal trichomoniasis culture test. Um, and then secondary outcomes was a microbiological test of cure, 6 to 12 days so visit 2, um, after being diagnosed at visit 1 in the per protocol population. And it also used the outcomes to measured were the comparison between the clinical symptoms between visit 1 and visit 2. And a negative vaginal cultural trichomoniasis test. So patients were randomly assigned in a 1-to-1 ratio to receive oral granules of sac-datazole, 2 grams, or a matching placebo oral granules in the primary phase, so during the first visit. Randomization was stratified by the site, so where the patient was, and the presence or absence of the symptoms at baseline. A randomized list did assign kit numbers to one of the 2 treatment groups, and that was generated before the study. The sponsor used that list to package the study drug into the treatment kits. So this study did involve a primary study phase, so that's visit 1 to visit 2. Visit 2 was 6 to 12 days after visit 1. And then there was a follow-up phase, which was 7 to 12 days after visit 2. Visit 1, baseline, a 2-gram oral single dose of sac-datazole or the matching placebo oral granule was administered to the patients under direct supervision. The matching placebo contained all the active ingredients besides the sac-datazole. Visit 2, so this was 6 to 12 days after the patient was 6 to 12 days after the first visit. They were evaluated for test of cure. And then they were also given the opposite treatment that they were giving during visit 1. So at this visit as well, they had a trichomoniasis culture test to see if they were positive or negative. If they were negative, they were discharged from the study. If they were positive, they were asked to come back for follow-up, which was 7 to 12 days after the second visit. During that third visit, if they were still positive for trichomoniasis, they were asked to come back a fourth time where treatment would be offered at the discretion of the investigator and per standard of care. So statistical tests used and data analysis. So the second, it was a 2-sided Cohen-Mendel-Hazel test that was used, which was appropriate for determining the primary and secondary endpoints. It was modified for the stratification factors of HIV status, BV status, and the presence or absence of clinical symptoms of trichomoniasis at the first visit. NAT test was used to determine if they had gonorrhea or chlamydia as well at baseline. And then the InTouch cultures were used to determine if they were positive or negative test of cure. These tests were appropriate for determining what they were measuring for. So the study determined that 100 patients, so 50 patients per group, would be needed to participate to provide the trial with a 95% power to detect a statistical significant difference in the treatment groups with a significance level of 0.05. There are 147 women enrolled, and 131 of those women were in the modified intended to treat, and you can refer to figure 1 for the confidence level and p-values. In the per protocol population, there were 119 women, and you can refer to figure 2 for the confidence intervals and p-values. There are 4 patients that didn't return for the TOC visit, and 2 withdrew their consent. In the per protocol population, there was 1 patient that discontinued due to mild nausea and a productive cough that was in the sac-datazole group. For the baseline characteristics, you can refer to Table 1 of the study. There wasn't a drastic statistical significance difference in baseline characteristics between the two groups. However, I do think if the study would have included the number of sex partners each patient had, that would have reflected if trichomoniasis was influenced by number of sex partners. So the primary outcome was the microbiological test of cure at visit 2 for the modified intended to treat patients. So these results were the secotrexazole, 74 out of 147 patients. The placebo was 73 patients out of 147, and there was a big success, 94.5% in the sac-adazole group compared to the placebo. The secondary outcome was also a microbiological test of cure at visit 2, but with the per protocol population. The secondary outcome results was that the sac-adazole, 59 patients out of 119, and then 60 out of 119, where there was a 93% success rate for the sac-adazole group. 12 of those patients were excluded because they were negative for trichomoniasis at the baseline. 5 of them were excluded because they tested positive for chlamydia and gonorrhea via a NAT test. And then 11 of them were excluded in this secondary outcome because they missed the second visit during the 6 to 12 days. Due to the patient's feedback, clinical significance had been established and clinical significance based on the test. So the author concluded that a single dose of sac-adazole 2 grams showed to be effective and beneficial in women and adolescents 12 years and older, even with patients that had HIV and BV. The safety profiles that, as far as adverse events, was lower in the sac-adazole group versus the placebo group. If this drug is FDA approved, though, a study for pregnant women should be considered since it was excluded in this population. The findings of this study provided statistically significant information supporting the effectiveness and safety of sac-adazole 2 gram for the treatment of trichomoniasis in women. So some of the strengths is that the sac-adazole did have a high success rate, so 92% to 95%. There were minimum very low dropouts as sac-adazole was tolerable. Nausea had the highest number of events with 2 patients. This outcome is important to real life as this is a very common sexually transmitted disease, and it did include a wide range of women. So it is very diverse. Potentially having it dosed 1 time a day will increase adherence, which may stop the spread of it. Some limitations with this is that long-term follow-up was not addressed, so we don't know the long-term effects of the drug. Men were not included in this study. It was only women, which comes down to confounding bias, which may have influenced the outcome. And then the exclusion of pregnant women doesn't allow for us to see the full effects of the drug. So sac-adazole 2 gram, in my opinion, the oral dose treatment in women with trichomoniasis has shown to be effective and safe. Additionally, it did have lesser adverse events compared to the placebo, while adherence did increase. Taking it 1 time a day is better than a multi-dose. While it didn't include male participants, it did show clinical significance and statistical significance throughout the study, and the benefits outweigh the risk. Thank you.